Thank you, Eduardo. Thank you, Mindy, and thank you, Raj. We asked Eduardo if he'd be willing to give us kind of a provocative take, and thank you for delivering on that. I think it's important to push ourselves and push the community on these issues. We're now going to continue with our move towards what fundamentally does partnering look like, and what does this move towards sectors working more closely together look like? So if I could ask the next panel to go ahead and join me on the stage as I introduce them. So we're going to be joined by Barbara Bush. Barbara has dedicated her career to promoting human rights from education to nutrition. And in 2009, she co-founded the Global Health Corps to support emerging global health leaders looking to promote health equity. We've got David Barish. He's the Chief Medical Officer of the GE Foundation, where he leads the Global Health Philanthropic Investment Portfolio. Tyler Nelson is actually a former Global Health Corps Fellow, and he now is the Executive Director of the NGO and not-for-profit Health Builders in Rwanda. And Purvi Bhatt, who has generously agreed to moderate this panel for us, is a Senior Director for Global Access at Medtronic Philanthropy. So could you please all welcome our next panel to the stage.
Thank you so much, everyone. And I'm going to do a couple of things just to, one, get us a little energized. We're at a pretty critical point in the morning, but also to help us understand who's in the room. So if you're working in healthcare or happen to have a health background and working in another sector or organization, can you raise your hands? All right, so that gives us a sense that's probably about almost a third to half the room of folks that are working in healthcare. We're going to pivot this conversation into healthcare, but I think it's going to be really important as we're going through this discussion to note that there are some very important common themes around what we need to do to move forward a shared value proposition when we're thinking about really disrupting what talent looks like.
I know, I just think...
but before we do that, I'm going to just list off a bunch of things that I've been hearing over the last couple of days. I know Justin has recapped, but I think it's pertinent as we move forward. So it sounds like the scenario in front of us tells us that we're leaving social value and economic value on the table. If you're in healthcare, we've known this for a long time. It's called value-based healthcare now, right? Value isn't equaling cheap. Value means value, and that includes the social side. It's a part of the outcomes that we drive. But baked into that are the inequities that we're trying to face. And so as social value leaders, and I need to read these because this was quite a list of things that we need to do. We have to see opportunities where others see problems. We have to find comfort in the white space that's in front of us. We have to understand the new context that we're in, and in order to do that, we have to bring a whole slew of other parties to the table, build a collaborative model to do that, understand and reach across the aisle to see what other sectors are there. Once we understand that context, we have to innovate and be able to deliver on a new way of thinking. We've got to translate results from that so that we can see whether it's working or not. We got to fail bravely when we find out it didn't work. We have to pivot quickly once that's happened. And all of that brings us to a place where we've got to understand how do we bring diverse thought partners together to pivot and come up with a new solution and come up with a hybrid of perspectives to solve it. And then while all of this is going on, we've got to grow our capacity as organizations. So I don't know about you, but I'm exhausted. This chosen angel cannot flap her wings much longer unless we come up with a way to think about this more creatively. And so that is the essence, I think, of what we're here to talk about today. And I just wanted to kick off with Barbara in particular, because I think you've seen this issue for quite some time, and that has spurred you to a solution from your vantage point. So talk to us a bit about what you're doing with Global Health Corps.
Absolutely, thank you.
Sure.
I could talk about a million things based on what was just listed, but we started Global Health Corps 6 years ago. And for those of you that don't know what we do, we are building the next generation of global health leaders. And Tyler was very lucky to be we were very lucky to have Tyler be one of our Global Health Corps fellows. But in 2009, we've talked a lot or heard a lot about millennials at this conference. In 2009, my co-founders and I saw that millennials were interested in global health more so than ever before, and that was a huge opportunity for the global health field. If thousands of young people want to get their foot in the door in global health. Can we open up the door so that we're bringing more talent to a field that needs more solutions and needs more boots on the ground? So every day we competitively recruit young leaders who are 30 and under to serve with Global Health Corps for a year. We partner right now with ministries of health, nonprofits, a few of whom are in the room, like PSI, CARE, Partners in Health. And we have our first private sector partner, which is GE. And they identify gaps that they have, and then our fellows serve with them for a year every day, working to address those gaps. So our program is in some ways a leadership development institute that has no walls. They grow every day while problem solving, and then throughout the year, they go through our very intense curriculum that's focused on advocacy, policy and systems change, and entrepreneurship, so that when they complete their fellowship, they can build off of this year to figure out how they can continue to navigate their role in global health. And we've been really excited for a few reasons. One is just the sheer amount of talent that wants to work in this space. We've worked with 600 young leaders. We closed applications a few weeks ago for our new class of 140. We received 14,000 applications for those positions. So that's great. Now it's our job to grow so we can get more young people into this field. And I think part of the reason we receive so many applications is that we're not necessarily looking for doctors and nurses. So many young people that have been interested in global health self-select out because they think, I'm not going to go to medical school. I don't see how I fit. And on the reverse, most of the issues our fellows are addressing with our partners are systems issues. So one of our first fellows in our first class is named Amit. He had a degree in engineering. He'd been working for Restoration Hardware and The Gap for a few years on their supply chain. He joined Global Health Corps and started working with Clinton Health Access Initiative at the Ministry of Health in Zanzibar on their two-person medical supply chain team. And so his skills from getting Gap jeans into Gap stores across the United States were equally transferable to getting drugs from warehouses into clinics. And he continued to do that work for a few years. And then when the Ebola crisis happened, he moved to Sierra Leone because that was very much a systems breakdown. So those same skills that he had started learning about in the private sector were and continue to be transferable to saving lives. And I think that that is what is exciting to us, is showing people how whatever skills they've honed, wherever sector they've been in, are applicable in building smarter, more effective healthcare systems. And Amit's story, same as Tyler's, is what is now getting interesting for us, in that we have 5 years of alums, and instead of our program being a one-year program, that one-year fellowship is our tool to get great talent into the field. 97% continue to work in global health. And we're excited for, in 10 years, them to be the Minister of Finance in their country, or them to be running GE Foundation or wherever they are, with this really strong network of others that see empathy and collaboration and resiliency equally as important as being effective as impact leaders in this space.
That's terrific. And just now moving on to Tyler, because I think it'd be wonderful to hear your story. And in particular, how does it feel to be an executive director now, and what kinds of skills that are particularly around leading have you been pulling forward?
No, I appreciate the question, and I love Barbara, but also I do feel lucky to have been part of this movement that's growing, that GHC has been leading or has been pushing. And one thing that to kind of act towards your question is Health Builders, the organization that I run now, is a systems-focused organization. And so the work that we do is focusing on improving public health facilities' ability to more efficiently provide the services they're supposed to provide to the communities they serve in Rwanda. And a big part of that is how they're managed and how they manage themselves. And so for us as an organization, we need skill sets. In order to transfer that capacity to the health centers in Rwanda, we need to be good managers ourselves. And a huge benefit that I've had in my career at Health Builders has been our collaboration with GE, because to GE, this is also a hugely important piece of capacity, is to be able to manage well, and it's a big focus of theirs. And I know David will talk more about that, but you know, being an executive director now and looking for fellows that can still work with Health Builders every year, we look for people that have the potential and the capacity to be good managers. And those come from organizations like the people, or the ones represented by you all here, not necessarily doctors, nurses, or those that are currently in the nonprofit sector. And so Global Health Corps does an incredible job of bringing in a diverse landscape of talent and people to be able to do that. And I mean, I came from a public health background and looking for a public health career, but found myself at an organization that was what I thought that I wanted to do, realizing that I didn't have the skills that I needed to do that. And so Global Health Corps helped me reach that, but also Health Builders, because of its vision and mission around management and putting in infrastructure in Rwanda where there isn't that infrastructure, and bringing in new technologies that improve the equitable access to primary health care really showed me that a systems level approach is so essential and important, and the skill set to do that isn't necessarily from the nonprofit or public health background.
That's great,
Yeah.
and I come from a public health background as well, and
Right.
found myself
Right.
tripping into these situations also, so it's great to see you elevate that. And so David, we both come out of philanthropy, and in addition to disrupting the talent pipeline, it's interesting to see how you've taken this scenario and really brought in a creative way of using philanthropy and bringing in a leadership perspective into it. So how does GE Foundation fit into this story?
Well, I think there's a couple of things. First of all, our shared value story as a company starts, interestingly, when I started to look at this, it actually goes back probably 100 years. And I was talking to Kyle Peterson last night about this and said, I think GE has been involved in shared value for a long, long time, obviously way before my time, but it wasn't until it got codified maybe 10 years ago that we actually started thinking about what shared value meant. Shared value itself was codified at that time, but we started with our Eco-Imagination program, which is about reducing carbon emissions and how it impact not just the environment, but also how it impact our business and reduce our costs. A few years ago, we introduced Healthy Imagination, which was about improving quality and access at the same time reducing healthcare costs, which not only benefited our consumers, but also benefited us as a business. And the GE Foundation is very much involved in sustainability and what we do and what GE does from a shared value perspective. What we do is we leverage not just our capital and what we can do from an investment perspective, but what we have from a GE DNA perspective and what we have to offer to our partners. And Global Health Corps is a great example of what we think we can offer to our partners. And one of the things that we have as a strong piece of our DNA is leadership. GE prides itself on leadership. It prides itself on its training its leaders. And when we look at our portfolio of things that we do from a foundation perspective, much of what we do is capacity building, and much of what we do is ultimately training leadership. So we looked at what Global Health Corps is doing and what Barbara is doing and said, maybe there's an opportunity for us to do something collectively. And I give Barbara a tremendous amount of credit for taking the risk to say, yeah, could we do something with the private sector? Would it work for us to do something with the private sector? Should we try it and see what happens? And I think it's been tremendously effective. We've done a couple of things, or there's a couple of values here. One is that we actually are able to teach these young leaders a little bit about the way the private sector thinks, and a little bit about our discipline and how it's different maybe from an NGO or different from a philanthropy or foundation. Although we're the foundation, we think very much like GE thinks. This is not philanthropy, this is an investment. The second thing that happens is we're teaching these young folks that the private sector actually can add value to what they're doing in their public health careers. I think Tyler's learned this from the work that he's doing with Health Builders, that we're not just there offering donation, we're not there offering, but we're there to add additional value beyond just the cash that we have. So teaching these young leaders about leadership, but also teaching them the value of the private sector. And that takes me to the partnership, because I mentioned Barbara was willing to take a risk here. This wasn't exactly that easy. We had to think a lot about how this would work differently. Even simple things like just an MOU. We think very differently about an MOU than a nonprofit might think about. It took a long time to work through that and to work through just the logistics of what an MOU should look like from our perspective and how we should work on a day-to-day basis. And then the second thing that was different was that being part of the private sector, we work really fast. When we start something, we just get going. And I think it was a little bit of an adjustment for not just the organization, but I think for the fellows to sort of, as they're coming in, say, oh, okay, we got to get going. We have to be self-starters here. The train is leaving the station. How do we adjust to that? And it's been a great year for us to learn about that. I think it's been a great year for our fellows to think about that. We've learned a lot from that, and I'm excited to sort of enter into next year. One other piece I want to mention is truly about partnership. It's really important to us when we make an investment that we think about our partners. And Global Health Corps and Health Builders have been tremendous partners in, number one, sharing our mission. Number two, being able to be really candid and open with us with what's working and what's not working. And the second thing is to get on this learning journey with us and get on this training, be willing to learn with us as we do it. And that to us is critically important. It's been a great example with both Health Builders and Global Health Corps to say, okay, let's go. Let's figure it out as we go. And as Purvi said earlier, some things are going to go well and some things aren't. If they're not going well, let's pivot and do it a little bit differently. So I'll stop there. I'm sure there's a lot more for us to chat about.
So what have you learned very specifically? I mean, has there been anything about this partnership, because it's brand new horizon, because it's really connecting with private sector and a lot of the stereotypical things that we believe about the private sector? It's not a surprise that things are moving fast. But have there been some lessons that have come back into the way that you all are working at GE? Have there been things from what GHC and Health Builders have been doing that have been surprises in how you've pivoted yourselves?
Well, I'll add one thing to that. One is you don't need people who are necessarily with a health background to have impact in health. One of our fellows is a journalist, and I will say she has had tremendous impact on us in the last year because of her teaching us how to communicate, her teaching us how to tell a story, her teaching us what you can do with social media. And I think and she has no health background. And so you don't necessarily need to, we asked the question of who's in health, you don't need to be in health to have tremendous impact in public health. We really learned that. And our other health fellow, who is a physician, has been tremendous in adding to our organization the perspective of what health is like outside the U.S. And she's working on a U.S. program, but she's been thinking about how to bring that expertise into the U.S. It's been great.
And Barbara, from your perspective, what has this first journey with the private sector meant in terms of your own strategic direction and some of the lessons that you're getting from this as well?
Yeah, absolutely. So as I mentioned, historically, we had Global Health Corps fellows within ministries of health or within NGOs. And we bring our fellows together 5 times a year for trainings. And so much of the trainings are actually just them being a great brain trust with each other, because they're working across 60 different organizations. They're working across sectors. And they often end up building partnerships with each other because they know what each organization is doing. And they have the opportunity to step back for 4 days with us and see how they might, we have fellows with Mothers to Mothers and fellows with Elizabeth Glaser Pediatric AIDS Foundation working in the same districts with the same populations. And both organizations have their head to the ground working away. And so this can be an opportunity for them to step back and see that there may be more alignment for partnership. And so I say that because we bring our fellows together so regularly, and what was always missing from the conversations was the private sector perspective. It has been really helpful for our fellows that are working in nonprofits to understand how ministries of health make decisions in the countries where they are, because so much of their work is done with ministries, and yet they don't understand how the private sector works. And so it's this kind of black box of what's going on, how are decisions made by the private sector or by donors. And so our fellows that are within GE have a much bigger role within our community now, because it's their job to now explain why they move more quickly at GE, or how decisions are made, to illuminate how partnerships could be made. And I think that has been a really exciting aspect of bringing another voice to our community. And something that we all talked about before is we are pretty agnostic to where our fellows end up. We just want people solving global health problems and doing the best that they can in solving global health problems. And though Global Health Corps is a nonprofit, and I might regret saying this, we will never scale the way that Medtronic could or GE could. Yeah. And that's just the reality of what we're doing. And so if our alums, which we also have a few alums with Medtronic, end up in the private sector and see their role there as scaling solutions, that's much different in terms of reaching more people. And I think that's something that we're having a lot more conversations with our alums about. I was with 100 alums this weekend for a retreat, and many of them are in the private sector, and they're navigating the complexity of how, I think, their identity being in the private sector. They had been kind of the do-gooder friend of their friend group. They got accepted into a really prestigious program like Global Health Corps. And now they're working for companies that have a purpose. And for instance, Medtronic will reach millions, if not billions of people via their products. And those are the teams that our alums are working on. But all of a sudden, they're not kind of the do-gooder in their friend group. They're working for the private sector, and they have to wrestle with, yeah, but actually, we will reach more people than Global Health Corps ever would. And I think that that's something that's really important. It's not an either or, it's where can we have the biggest impact and what is our mode going to be to get there. And if it's the nonprofit, great. If it's changing policy, wonderful. Or if it's the private sector, excellent. Let's create products that will serve more people.
That's wonderful. And just to punctuate that piece about integrating people into the business itself, we have benefited greatly from a steady stream of alums that have come out of not only GHC, but some others as well. And why we've done it, and I think many of us in the room have done it, has been because of the beginning, that long list that I started with. In order to make the needle move on that list, we have to bring those perspectives in. And the best way to do it has been through this great training that people have come through in real life, as well as this intentionality of what David and this partnership are pulling together. So I can't punctuate it more to say to take all of this into consideration as we're looking at where are we going to get the resources to really break open what we can actually do in these environments. And so with that in mind, and Tyler, being the alum that's with us here, how do you convey this partnership with those alums as well? And more importantly, what is the next generation, the next cohort of alumni really looking for as they're hearing more and more about what's coming through this work?
I mean, I think it's as varied as the 14,000 people that apply, which I think is a good thing. And I think that Dr. Kim said it the best yesterday when he said, we're not going to reach enough, or we're not going to reach everybody without the private sector. So I think that as that group of interested young minds gets more and more interested in global health or other social issues, the private sector is going to have to play a bigger and bigger role in formulating what that means to them and jump on board. And I think that this forum is a good indication that that's happening. So I would say that it's quite diverse and varied, but I think that the more that everybody in this room steps up and engages more and more in this effort, the more you're going to find that young people like me and my colleagues are interested in joining and working with you.
Oh, that's fantastic. And listen, let's open up the Q&A and get some of your thoughts in this. And let's start with David. I think there's just a great bread and butter question that's here about what more you can say about the initiative and how we think about it from philanthropy and from the company itself. It's a common question that I think folks in our roles tend to face.
Yeah, so we think about our philanthropy, if you will, as I mentioned, I think a few minutes ago, more as an investment. And I think Tyler mentioned, or it may have been Barbara, I can't remember, but donors. We're not donors at the foundation. We really think of ourselves as investors and long-term investors, and that's one of the reasons we invest in Health Builders and we invest in Global Health Corps, is that we think there's a long-term opportunity, a long-term strategy. It's very much the same way the business thinks. And from an alignment perspective, you think about, we're talking about healthcare, but we're talking about in the earlier panel about access to water and access to power. As a company, those are three things we're very strongly engaged in: access to health, access to water, and access to power. As a foundation, we're doing the same things. We're thinking about access to health, access to power, and access to water. The difference is the return on the investment that we expect as a foundation is really impact. And it's really social impact on the ground. I think it's impact for the fellows. It's impact in terms of learnings that we get from the investments we make. And it's impact in terms of being able to pilot and build programs that will be sustainable. So we think of when we make an investment, it's about, as an example with Tyler, we're investing in an oxygen plant in northern Rwanda. That's a pilot demonstration project that says you can build an oxygen plant in remote northern Rwanda that'll have opportunity to scale, to be sustainable, and to have a sustainable business model. So we don't expect a return on that money, but we expect to build something that'll be ultimately then scalable. From a business perspective, they're essentially doing the same thing, but their returns are different. They have a social return, an economic, as well as an economic return. So we're sort of marching in the same direction. We just do it with different models in place. Hopefully that answers the question.
That's great. And just staying with that theme around outcomes and the way that the company is thinking about outcomes and the philanthropy as well. Barbara, from your perspective, what kinds of things are you measuring from this process? What kinds of outcomes are you starting to see change?
Absolutely. So we measure a lot, primarily because we're a new organization. And speaking of pivoting, we've pivoted a lot just because we want to make sure we're building, our business model was really great on paper. And then life happens and maybe paper doesn't look exactly the same. So we have a few things that we're interested in. One, wanting to ensure that our fellows have an impact in the year that they're with our partners. And it's not apples to apples, but our partners say what their biggest gaps are before our fellows arrive, and then we can measure the delta at the end of the year. So the year of impact is important. Secondly, we measure what this talent pipeline is doing in the field of global health. So where do our alums go? How connected are they in the field of global health? Are we helping them get into positions of greater influence where they're, Tyler is young, he's the executive director of a large organization, where they then have the skills and capacity that they need to be effective. So this looks like a number of things in terms of tracking career paths. We were really excited this year to find out that 22% of our alums have successfully changed policy around health outcomes in the country where they're from. So seeing if they work on policy change, what their reach is now as they're in new positions. And then lastly, and this is something newer, we're measuring the power of our network. So our alums have been staying typically in the regions where we work. We're getting more saturated in East Africa, Southern Africa, and the Northeast in the United States. And our alums are highly connected. They speak to 22 other alums a year, and that can lead to really interesting collective impact opportunities. So in order to build a model that will allow that to happen, for instance, this week, we had 60 alums working on family planning and women's health issues meet with the Ministry of Health in Uganda for a day and a half to talk about what they can do collectively across their 40 organizations with the Ministry of Health to impact family planning in Uganda. And that is a networked approach that is not something we ever thought we would do, because we just weren't sure where our alums would stay. And now that 97% of them stay in the field and they're moving into senior leadership, it's affording a lot more opportunities for impact.
Absolutely.
And I want to speak to that quickly as well, because Health Builders as an organization is, in the position that it's in because of Global Health Corps in a lot of ways. We have multiple former fellows who are on staff, who are in leadership positions within our organization, not just including myself. And we've been able to maximize a lot of our impact because of the skill sets that were brought in. And so, Global Health Corps can attribute a lot of the impact that Health Builders has in building up basic primary healthcare services in a fifth of Rwanda as a result of their partnership with Health Builders. But on another note, we Global Health Corps just organized a panel with the Minister of Health in Rwanda just a couple weeks ago that I attended that talked about health finance reform and where Rwanda is moving in being able to better pay for all the health services for the 11 million people that live there. So, the impact continues to grow, and I think that it's hard to measure it when you're talking about the long-term, career potential of these fellows. But I can anecdotally say for sure that at Health Builders, it's a real impact that we're seeing every day.
That's fantastic, and I know that everyone here is used to big scale, right?
Yeah.
That's the prize at the end of all of this. Have you seen opportunities where you've been able to partner with others to try and leverage the scale of the work, specifically the model that you're putting forward, whether it's Peace Corps, whether it's other fellowship models? How have you tried to leverage against that to take this even further and better? Because these are fantastic results. So
Yeah.
how do we move faster?
Well, we have been so lucky to have started in 2009 when the Peace Corps had been around for years, when Teach for America had been around for years. I first got connected with GE because you talk to anyone around who does great training, GE comes up every time. And so we have been so lucky that so many great models already existed. And Teach for America sat with us a number of times our first year to talk about where they had seen success, what their missed opportunities they thought were. They all wish that Teach for America, City, or Peace Corps all wish that they had done more work with their alums right away. And that was great for us. We didn't have any alums yet, but now alums are our biggest part of our impact model. And so we've really learned from those models that are more traditionally nonprofit, and then gotten to spend time with GE at Crotonville learning about their training models, because we are essentially trying to do that type of training model for the field of global health. And so we're just very lucky that so many other organizations have been generous with their time.
Wow, that's great. And with that in mind, as we're getting close to wrapping up, would love to get the kind of advice you would offer from the perspectives that each of you are bringing to us. And let's start with David. We've got a room full of folks representing different sectors. What advice would you offer to those of us from the private sector in moving forward these kinds of ideas?
Well, generally, I think it's a really important, my advice, I guess this is really also our passion. My advice is that really engage early with leadership training, and with the millennials, with youth, and get them engaged. I think, we talk about sustainability a lot. Sustainability comes from having the passion, having youth being passionate, training them appropriately so that anything we do now has sustainability. And I think, we talk about health, education, power, and water. To me, the crux of it is education across the spectrum, including leadership. And so focus on bringing young people in, focus them on giving them programs to be involved in. I think, we didn't specifically talk about the programs that our fellows are involved in, but they've actually had impact in the year that they've been with us. And so give them the opportunity to have impact, train them on how to have impact, and then, as you can see, through Tyler and other examples, just go ahead and let them flourish. I think get them engaged. Yeah.
Great. And Tyler, from your perspective, from an NGO and as a leader of a nonprofit, what kind of advice would you give to some of the other nonprofits that are sitting in the room based on this partnership?
Yeah, I would say sort of along the same lines as what David said and what I said earlier is that it's really important to invest in management and to invest in leadership. And as an organization that focuses on management and leadership, it makes me sound a bit biased, but that's because I am. So, investing in management and leadership and the capacity that it takes to do your job well, to do your function well, and to provide the services that you want to provide to the communities you're serving well, you need that talent and you need those skill sets. And so if we can invest in that management, it's going to build up everybody, and it's going to put us all on the same page.
That's great.
Yeah.
And then Barbara, for those of us that are really trying to start off with new ideas, support new initiatives, you yourself are an entrepreneur that really took off in bringing this to all of us. What's your advice to us who are trying to nurture those new ideas?
Good question. I guess this goes to something you said before. I mean, if you have new ideas, we all work in the impact space. The worst that can happen is you can fail in trying something. And I think I'm curious now that Global Health Corps is a little bit older. When we were starting, there was no fear of failure. It was an idea that if we could try out our model and if it was successful, great. If no one applied to Global Health Corps, at least we tried it and it wasn't going to sit on a to-do list forever. I worry as we get older as an organization, is it scarier to fail because we have a good track record now, and yet we work in a space that has tremendous potential for solutions, and the fear of failure isn't worth it if we're not going to solve problems. And so it's a hard thing to wrestle with, but I guess figuring out how to pilot things that can be safe in some way to see if it really can impact change. And then one other piece, just because millennials have come up a lot here, is we were laughing before. I am at like the very top definition of a millennial. I have aged and I'm clinging on to the millennial title. But
It's okay on the other side.
I don't know if you pass it, but there's a new generation below millennials. But I think investing in, as cliche as this is, the reason that we work with young people is it's not a Band-Aid solution. Our alums will stay in this field for the rest of their careers, and they will move solutions forward. And while I know every company is trying to figure out how to work with millennials and they have millennial problems, I think if you can think of it more as this is our long game, we'll work out the kinks at the beginning, then it's a different way of thinking about investing in your leadership who are young, but they're leaders, and they will move your work forward also.
Well, that was beautifully said, and I think the best way to end this panel, also just saying, look, that long list of things we started with used to be slide 20 for many of us in our strat plan. It is now slide 1, which means this way of working and this wonderful way of thinking about our millennials, they're not the problem, they're the asset. And I think when we talked about equity yesterday, I think that was a really important way of shifting from thinking about the fact that the demographic is our asset, it's not our problem. And so from that perspective, I hope we can move forward into the day, and to please join me in thanking our panel.
Thank you.